Hi. Hello, welcome to Knock Knock Hi with the Glaucomfleckens. I am Dr. Glaucomflecken,
I'm Lady Glaucomflecken.
and we are so happy to have you here. It is mid-July, and this is an exciting time in medicine
It is.
because July 1st, actually, you know what? It's not even July 1st now. Like
Yeah, it's kind of scooching
a
back,
lot
isn't
of
it?
residencies are starting their interns like a week or two early.
Yeah, I've noticed that
When
on
did that
social media. There's a
happen?
lot of people.
Why is that? That's not fair.
Yeah.
Like give your new interns a break. Like let them enjoy their last vestiges of life.
Well,
I
I
don't
don't
want to say
know.
that.
Don't
That's
you
not fair.
remember that like 2 or 3 weeks in between, like when med school was
Yeah,
over and residency hadn't quite started yet, and like the time off was kind of nice, but the financials of the situation
that's
get a little
that's
tricky for
true.
people because you're
Absolutely.
going a few weeks without any sort of, you know,
I do remember thinking.
payment or loan or anything.
I remember like looking at Cobra once. I think it
Uh-huh.
was, and
Yeah, I
and I
think
was like, oh, this is not possible.
right.
Like this is like $3,000 a month. This is insane.
Yeah.
And I think I want to say we just kind of
Hoped for the best.
hoped we just let it go and hope for the best, which is terrifying knowing my medical history.
Yep.
It all worked out. But anyway, so now interns and like the medical year is starting now a little earlier. But now a lot of interns have had about a month and
Mhm. At
everyone's
least a couple weeks for
I'm not,
people to settle
yeah,
in.
and I just want to clear something up. There has been, you always hear like people make jokes about this. And this is actually something I never make a joke about because I don't it's not true and I don't want to like sow any angst and fear regarding this issue of like, oh, you don't want to go to the hospital in July.
Right.
It's
That's when
not
all the
it's not
newbies
that's
start.
when all the new doctors, that's garbage, all right? Yes, there are lots of new doctors, but you know what? You know who also recognizes that there's new doctors? All the old doctors. They know. They
They're never
know.
paying closer attention than
Everyone
July.
is there's lots of supervision, everybody's double checking things,
Mhm.
and they've I wanna say there has actually been a study looking at, like,
Yeah.
mortality and certain, like, health measures, in July versus other times, and it's, that's an unfounded fear,
Mhm.
and so, to all you people thinking about out there, thinking about getting something done, some surgery, some procedure. July, it's fine.
In
It's
fact,
fine.
you know what? Maybe it's even better because
Yeah.
those fresh, people fresh out of med school,
They're
they
super
have
smart.
learned a lot, or
They know
people
a
fresh
lot.
out of residency, those people are like the most
They come with a new
knowledgeable
perspective.
of everyone.
They come with a new
They're
perspective
up
and
on the newest technology.
exactly.
It's all still fresh in their mind.
And their attendings are vigilant.
Yes.
They're hyper vigilant. They know where the shortcomings are, where the new interns and new doctors need to grow and get the experience. And so they're on it, you guys. All right,
Yeah,
it's
and so
fine. It's
if you
fine.
go in and you're a patient, just, be patient. No, but really have a little bit of like understanding and compassion that they might be a little bit nervous because
Yeah,
they're
things
they're
might move a
new,
little
they're in a new
slowly,
job.
but you're still gonna get great care.
Yeah.
Don't worry about that. I'm more just like they're right now they're all like super stressed.
Yeah, I know. I
And
feel protective over the new people.
I
I don't know
remember
why.
I remember what it was like,
Yeah.
like being unsure of myself and not knowing if I'm ordering the right dose of Tylenol.
Right, right.
And relying on the people around me, the pharmacists, and getting advice from them,
Yeah.
and physical therapists and nurses and all that. Just like really, like leaning on the team to just like provide
Some checks
great
and
care.
balances. Yeah,
Exactly, just
yeah, and
making sure.
also go check in on those people's families, the newbies. They've all just moved to new places for the most part, and they're all starting new jobs, and they're trying to get established, and, like, don't forget about the families
Of the
of
new
the new
doctors.
doctors.
Yeah,
Yeah, yeah.
that was
Or
you.
new med
That was you
students.
once upon a time.
That was me, yeah, but that's a lot of people, and, people forget about the invisible support systems behind all of the new doctors, so
I'm trying to remember what rotation I started on.
I have no idea.
Maybe emergency medicine or I don't know. I don't know. I've blocked out a lot of that
Yeah, I
time.
do remember taking a picture of you on your first day of residency. Maybe I'll have to share that, like a first day of school picture.
Oh yeah,
And
you
then I
did
also
do
took a
that.
last day of school picture on the day you were done with residency, and you had, like, your lunchbox and everything.
I looked quite young. I did.
Yeah, that was a long time ago. We're getting old.
I know. All right, let's get going on this episode.
Yeah.
So we have a special guest today, Dr. Zach Antonov. All our guests are special.
Mhm.
Dr. Zach Antonov is it's his pen name actually. He's an author and a practicing anesthesiologist, and he has written a fantastic book that is
I'm very intrigued by the title. I
yes,
really wanna read it just to figure out what that's about.
it's called "I Watch You Sleep: A Doctor's Tales of Anesthesia and Chain Restaurants."
Like, what do the chain restaurants have to do with it?
I love it.
Also,
So
what are you watching me do in my sleep? I just have so many
exactly.
questions.
So we talked a little bit about his book and just about practicing anesthesiology. He pulled down the blue drape for us and
Mhm.
told us a little bit about what his job is like. And I think it's kind of fascinating for people in medicine, but also people who have always wondered, like, what is it that's going on while I'm asleep? Which
Mhm.
is a question that Kristen asked.
Yeah,
So
it's one I have all the time.
so here we go. Here is Dr. Zach Antonov. All right, we are here with Dr. Antonov. Zach, thanks for joining us. So excited to talk with you.
Well, I'm honored to be here. You must really be kind of digging at the bottom of the barrel to have me on here. I think.
Yeah, we scraped and scraped,
Yeah,
and then we found you, and you're here.
yeah. Am I like the first non-famous, non-influencer guest you have on? I mean, there's not a single
No,
set
No,
of
no, no.
embroidered figs and fig scrubs in sight.
man, famous people are boring. Like you're probably gonna be bored talking. Not that we're famous, but I mean, it's we like the bottom of the barrel people if that's what you
Okay,
prefer to
well
call
that's me.
yourself.
We are bottom of the barrel people at
Okay,
heart.
I'm in
Just a
good
couple
company then.
of bottom cellar dwellers talking to each
Yeah.
other. That's all we are here. And
Well,
Zach, it looks like you're in some sort of awful appearing cubicle right now.
Mm.
yeah. So I don't know when's the last time you've been in something called a call room before, but that's
Oh,
where
I've heard
I
of
am
those.
because tonight I am going to be in the hospital on call working.
Oh
But it's
man.
this place inside the hospital where you can sleep the
Yeah?
whole time or work the whole time, depending on what's happening.
They got like prison issue sheets and blankets and pillows
Yeah, it
there?
says, property of Rockland County Prison. Across it from it, I think they get like the third hand sheets.
Actually, this is a good question. When was the last time I was in a call room? It's
Mm,
gotta be I didn't use it in
2014?
residency. It was all
Oh, you
home
didn't.
call. It
That's
was all
right.
home
That's
Oh,
call.
that
right.
oh, that's
Which
nice.
home call is a scam. I don't
It
know.
is.
It's a scam because it's an excuse to bypass work hour restrictions in residency so that you can still work all day the next day.
Yeah.
That
And to
that's
pay
that's how
you
it
way
works.
less of a salary too, because you can't do anything anyway the whole day. You're just like always on edge. Oh, I can get a call here. I can get a call there. I can't go anywhere.
So Zach, I want to ask you a question because
Ask
you have
away.
a background in comedy. You're a writer and you write very funny stuff, and
Thank
you've
you.
dabbled in a little stand up comedy. Just as a general question, are doctors funny? What do you? What's your gut reaction? Are we funny as a field, as a vocation?
As a field and vocation, I think no, and I think overall we're not really allowed to be. And I think you probably gotten that sense when you started off on your Glaucomflecken journey. You had to hide behind a nom de plume at first, and
I
society
did.
just expects doctors to have a certain demeanor, to present themselves a certain way. Lives are in their hands. You can't be saying like, "Okay, I'm about to save your life," but then also check out this one liner I've been working on. But the stuff that we do lends itself to a lot of humor, and
Yeah.
I think many doctors use humor as a way to process kind of all the intense stuff that happens in medicine that many people probably can't even comprehend,
Right.
or they might even say, "How are you making fun of that?" And you say, "Well, I mean, gallows humor. It's
Yeah.
some people's defense mechanism." Um, but I'm glad you found me at least here to liven up your show with humor. There's been a little too much serious stuff about
There's
things
Yeah,
lately.
he's not very funny, so I'm
the
glad that you're here.
I struggle. I try my best with the jokes. No, it's I think we I think in general, what do you think the answer is? Do you think doctors are funny?
I
You've
think
interacted with a lot of doctors that are not me.
yeah, yeah. I think when they're being doctors, no, they don't tend to be funny. Whether they are funny as humans, I don't know because it's like he said, I don't think you guys are allowed, quote unquote, to be funny. Like it's considered unprofessional
I think we're
in a lot of
maybe
circles.
not as funny as we think we are.
There's that too. I think you guys are pretty good at like dad jokes. Like that's
Oh
nice,
yeah.
safe humor. I've
Yes.
encountered a lot of dad jokes.
Yeah, that's my go-to with patients. You know, you
Yeah.
talk about like I get asked this question a lot as what is do you tell jokes to patients? Like is are you like this? Are you doc? I'm like, no, I'm not like a comedian like in my day-to-day life. I'm sure you feel the same way, but when you bring jokes in, it's very dad jokey. It's
Yeah.
very kind of like corny, safe humor, right? Do you, as an anesthesiologist, as you're pushing the propofol and you're sending patients off into sleep, do you have any? What do you tell them? What do you tell people? Do you try
Well,
to make them laugh, or is that a dangerous proposition right as people are about to go into unconsciousness?
well, hopefully, when I'm pushing the propofol is not the first time that I'm speaking to the patient. If that is, that's a very traumatic, really bad thing. Where if that happens, I might whisper into their ears some platitude because that might be the last thing they ever hear in their life. You know,
Yes.
but
You
in
start
a
saying like a Hail Mary or something
Oh
as you're
gosh, yeah.
no, in a normal situation, anesthesiology is unique because surgeons, all these other doctors, like you're a doctor, right? Will, right?
I
kinda.
technically yes, I am an
Okay, okay.
ophthalmologist.
So you build up somewhat of a relationship with patients before the actual, cutting into the eyeballs, into the body. Anesthesiologists, we have maybe 3 to 5 minutes before the surgery to establish who we are, establish rapport, gain confidence in the patient to put
Hmm.
their lives in our hands. So it's a lot of reading the room. If I walk into a patient's room and they're clutching some crosses and they're saying prayers or
Oh
something and the
gosh,
whole family is around them, I'm not going to be telling some dirty jokes there, as opposed to
yeah,
if
yeah.
you go into a young patient's room, they're cracking jokes with me, I'll respond in kind, and I think that goes a long way with establishing kind of this intense trust in such a short amount of time, which is, I think, very unique to anesthesiology.
The last time, I'll just tell a quick story. The last time I received general anesthesia was when I had a my subcutaneous defibrillator placed,
Hmm.
and I didn't meet with the anesthesiologist. At least I don't remember it. They probably did come in, I'm sure, to say something, but the amnestic effects of all the things that you
Uh-huh.
do, it's all hazy. But the only thing I remember is being wheeled into the room, being scared to death, and the anesthesiologist just said, "Are you nervous?" And I said, "I've never been more scared in my life." And then he pushed like 10 milligrams of Versed, and that was the end of it. That was
He's
it.
like, "Okay, I'll give you a
Yeah.
I
little
was
You're
extra."
still
done.
in a
That
dream.
was I
Yeah. Yeah.
and I
That's how come everything has gone so well. You're still
Yeah.
dreaming.
You're
yeah, that's
gonna
right.
wake up,
And
you're
I'm
gonna be
s
a resident.
and I'm so thankful for that person. I don't even know who it was. I don't remember any other interaction, but it was, he's one of my favorite
That
people
is
at
my
this point.
experience as well. Like with epidurals, I've had 2 kids. The
Mhm.
first time I tried to do it without an epidural because I didn't know
Mhm.
any better,
Mhm.
and oh man, when that epidural hit, it was like the best feeling I've ever had in my entire life. And then when the second one came, I was like, just hook me up right now. As soon
Yep.
as I came in, you guys
How do you feel
work
about
some
doing
magic.
epidurals? Are you is that what's your favorite part of the job?
I'm in a community setting, so we kind of have to do everything. We do the epidurals, the
Mm,
labor stuff, the general ORs. We respond to codes and airways. If you're in an academic place, then everything kind of ends up getting subspecialized. You have the people that only do OB and epidurals. You have the people that only do general anesthesia, only do pediatrics, hearts, whatever. But
mm.
Yeah, and I think that's the reason I went into community practice. I wanted to keep doing all the
Do
stuff
it
that
all. Yeah.
I used to do, except the big things like hearts or transplants. Those obviously don't go to community centers, and you wouldn't really want them to. But otherwise, I do everything. Epidurals, regional blocks. I even sometimes have to interact with ophthalmologists for their cases. Um,
No.
it's
No, you
yeah,
don't. No
I
way.
do. I get the Versed ready.
That 1 milligram, that 2 milligrams. That must be very exciting for you guys.
Mm.
It's very exciting, especially when you have 20 lined up in a day. It's great. But anything
I
we
always,
can
in
do
fact,
to help you.
you're right. I always feel bad, like when I see you guys doing like eye rooms because you don't have any time for breaks. Or I mean, you do find time for breaks, but it's so fast paced. We're like constantly turning over, and you don't.
You might only get one
I
Sudoku
feel like
in.
you enjoy like having a little bit of time to just check your portfolio. I don't
Yeah.
know.
That is true. It's the hard part about it. The hard part about it is just the requirements that we have to do. There's so many clicks and check boxes for every
Oh
single
yes,
case you have to do. If that weren't an issue, if it was just actual medicine that you had to practice, that would be the easiest day in the world. You say hi to the patient, you ask what medical problems they have, and then you say, I don't care because you're just getting an eye done. And then you bring them into the room and you give them a milligram of Versa and you sit back. Like that's the easiest day, but it's the same amount of clicking for a 5 minute case as it is for a 4 hour case. So we lose a
there you
lot of
go.
time there.
Right. I have a question because I'm not in medicine at all, and
We
I
got lots of
think
questions for
I
the
think
anesthesiologist
this
here.
is a common fear, right? Or at least a common concern, which is, what are you doing to me while I'm asleep? I mean, other than the surgery, like
Mhm,
obviously that's happening or whatever the procedure is, but like when someone is under,
mhm.
like, are y'all in there making fun of us? Or,
No, come on.
like that's the concern is like,
That's your
what
concern or everyone's
I think
concern?
I think some people have that
A little
concern of just like,
self-conscious about being
well,
asleep in front of strangers?
because it's so vulnerable, right? Like you have
Yeah.
no way to know what is happening to your body. And then you just wake up and everybody's gone. And I don't know. There's just a large gap in your imagination of, what could be happening during that time. And people feel it in all sorts of ways. So tell us, clear it up for us. What's going on while we're all asleep?
Well, you had 2 kids, so it sounds like that could be the most vulnerable place you've ever been with your legs splayed open and 40 people in the room looking at all the stuff.
I don't feel vulnerable in that situation, honestly, which is kind of funny. By that time, you're like, I don't care.
Get
I
it
don't
out
care
of me.
who's in here. I don't care what they see. Just get this kid out, right? Like, I
Yeah.
feel like you're more, it feels more powerful than vulnerable, if
I
anything.
think
Yeah.
maybe what Kristen is saying, what are you doing behind the drape, Zach?
Yeah.
What are
Sure,
you
I
doing
can
back there?
I can pull the curtain and you can see the puppet master and what we do here. In terms of what we do to you, there's a lot of things that go on depending on the case. There's a lot, after you go to sleep, there's a lot of things that have to happen. We have to secure your airway with a breathing tube or not. We have to start all the medicines to keep you asleep, make sure you stay asleep. A lot of medication management, for blood pressure, paralysis, all of that. Sometimes
Yeah.
we have to put other things uh, inside you, so to speak. Temperature monitors, suction things down your mouth or throat to suck out your stomach, other IVs that can happen while you're asleep. So those are all the things we do to you while you're asleep. Maybe if you have a
They
really super cool tattoo that's super visible, we might go, that's pretty cool. Um, but
they
in
have a
terms,
lot of syringes, a lot of
yeah,
medications.
a
That's what
lot
I
of
remember from it.
Yep. A lot of medications, but otherwise, that mantra is pretty accurate where it's, 99% boredom and 1% sheer terror. So hopefully you always
Mm,
fall into the 99% boredom category, which means everything is going okay, where we're just kind of the pilot's on cruise control. The ventilator is doing its thing, it's breathing for you. Our medicines are turned on, they're going in, keeping you asleep. Um, so,
right.
I mean, Sudoku is such a trope.
It's
I
a
mean,
cliche,
it's
yeah.
Candy Crush now because we have cell
Oh,
phones. Like we
good
don't
to
need
know.
pen and paper there.
Yeah,
So that's it.
that's right.
So
It's
we're
pretty old fashioned.
It
That
is.
was an
It
we're
is.
oversight on your part.
yeah,
Well, I have the character holding the Sudoku book just because I needed a prop.
yeah.
Yeah, yeah.
The
I
Dell
can't hold
Sudoku
Candy Crush.
extravaganza.
You
Yeah.
got it, yeah, that I found at my local, gas station one day. That's where most of my props come from very, you know, just random places.
Disreputable, yeah. No, like
Exactly.
dollar stores and stuff.
But
Very cheap.
I wanna talk about just anesthesiology as a career because I in the scheme of, like, work-life balance, you got, like, ophthalmology. So you got me, like, I'm always running my mouth off all over social media about how great my work-life balance is and making jokes about it and everything. But I always say, anesthesiologists, you guys, you fly under the radar a bit. People don't realize, like, you got it nice. Like, it's not bad, you gotta get up crazy early in the morning. That's really the only thing. And you mentioned that 1% of the time when things are, absolutely terrifying. So could you speak about where do you think you fall on the work-life balance spectrum? Am I correct in my assessment of this?
So I think anesthesiology has always been a part of that classic ROAD lifestyle thing road,
Mhm.
radiology,
Oh, the
ophthalmology,
road.
anesthesiology, dermatology. Um, I
With a
think that
capital D, let's be honest, like dermatology,
is a
there
lowercase.
that's the yeah.
I think that was maybe the case back in the day, the good old days. But now I think every specialty has its share of, you know, lifestyle issues. We, as anesthesiologists, like you said, we basically have to always be on, unless you're working at a surgical center where you're just, business hours, Monday through Friday, you get all your holidays off. But otherwise, you need people to do the surgeries, to do the traumas, to do the emergencies, the open globes, the appendectomies that come in, things like that. So, one negative is that you never know when you're going to be on, you never know when you're going to be off, as opposed to someone that
Mhm.
knows I'm going to be home at 5 p.m. every single day. I'm going to sleep in my own bed every single night. I'm going to eat dinner with my family every single night. So that's really a very big rough aspect of that. I don't think people appreciate. We're basically always concurrent with the surgeons, except we have to probably get in even
That's true.
earlier than them because we're the ones that have to do everything first. They just show up and sign a paper and start cutting
Yeah,
after everything's already been done.
Oh, that's all.
what set you on the path to anesthesiology?
I was everyone thinks in medical school kind of angels would sing and trumpets would blare whenever you did your first day of
Yeah.
whatever rotation you're meant to do, right? And you're going to be like, yes, this, like, every time I ask someone about their mother, I get this high and I want to go into psychiatry and, things like that. But that's rarely the case. It's more of a, I think, practical decision. People have multiple interests, multiple dislikes. You can say, "Oh, I like dermatology and I like pediatrics." And then you kind of just have to analyze yourself, analyze the realities of things, the financial prospects, what you want out of life. So I did that. I was interested in urology at first.
Mm,
Um,
That makes sense.
yeah, I do like being in the surgical space, the procedures, the fast-paced nature of it. I
Well, and
actually
neurologists have a really good sense of humor, so
Oh,
I
yeah.
feel like
Oh,
mhm.
you
yeah, that
yeah.
was a big thing. A urologist told me, "Well, you know what the only difference is between urologist and anesthesiologist is?" He says, "Urologists play with other people's dicks during the case."
Right.
Um, but then I did anesthesiology. It wasn't a required elective. I don't think it is required in many places, so you have to actively seek it out. And I just like being
Mhm.
behind the drapes, kind of the puppet master that sort of pulls the strings. We're not in the limelight, but we do a lot of things to make the surgeons in the limelight be able to do what they do. And I like the
Yeah.
blend of medicine, the medicine aspect of it, because I really do like, thinking about all aspects of things as opposed to just, okay, here's my one problem that I have to concentrate on. And we're really kind of throughout the whole hospital. Like you said, we're in labor and delivery helping ladies. We're in the operating rooms. We're in the emergency departments. We're throughout the whole hospital if someone stops breathing or has a code. So I really like that aspect because I can just go through any door in the hospital with my badge and no one else can say that.
I did a 2-week elective. I don't know if you remember, probably not. I did a 2-week elective in anesthesiology, and it was one of those classic, like I was done with everything else. I just had to do something in med school. I think this is my 4th year,
Mhm.
and I I just remember the sputum. There's so much of it, and it's I just like this is not for me. I cannot. No,
You
no.
have to pick your
I did.
specialty based on which bodily fluid you
You
hate the
do.
least.
Yeah,
That's what I'm
you
learning with this
absolutely do.
podcast. Yeah.
And I did. I attempted one intubation, and I did it successfully. And I was like, "That's it. I'm done. Like
I'm out.
I'm 100% on my intubations. That's it."
Yeah. I have to ask you something that I would have to ask any, self-professed comedian, which is who hurt you?
Who hurt me? Oh,
What
everyone,
happened to you?
everyone in my life. Uh,
Have you ever been hurt?
where did he touch you? Show me. Uh,
Yeah.
no, I wasn't a stereotypical class clown. I was always the kind of good boy, straight A student that parents loved having over, always telling their own kids, "Why can't you be more like him?" But I was always drawn to the comedy and absurdity of in the mundane and everyday, and it would occasionally show. One traumatic memory I have was in elementary school um, when I and another classmate, who was actually very curiously gifted as well, we just like wrote some kind of witty but kind of crude, dirty poem just for fun. And the teacher found it, and we got in big trouble. They called our parents. Typical, elementary school boy stuff. Penises,
Uh-huh.
things like that. And I'm like, Jesus, come on, this is clever, like clever and funny. So it was all downhill from there. Um,
I recognize that
Yeah,
response.
it
Like,
was.
"Oh, yeah, it's a good joke. I stand by it."
I may have
yeah.
said that once or twice. And so you kept doing. I know you dabbled in a little stand up comedy, in college and med school, and what are the types of things? Because what I've learned is that because I used to do a little stand up comedy as well. There's a big difference with medical audiences versus just a general audience. And I still say to this day, like I've been just doing strictly medical comedy for so long, I don't think it would translate to like a general audience very well. And so when you were doing a lot of stand up, what was it that you were talking about? Were you incorporating a lot of your medical education and training or in your job into those sets you were doing?
At the time that I was doing it, I wasn't like exclusively medical humor because, like you
Yeah.
said, we can be pretty specific. I wasn't making jokes about, oh, I was doing a subtenons block for this ocular case, and then he had a hematoma. Um, so a lot of it was
I'd have laughed my ass off at that. What are you
I would have
talking
had one
about?
laugh. Great. But I would mix just my experiences throughout college and residency, and you kind of have to pick and choose what you think would be funny to the average audience. Anything with sensitive subjects always lands. Rectal
Yeah.
exams, penile exams, just all of that because people can relate. That's people's kind of fears or anxieties about the doctor. If you start making jokes about, oh, I had a patient die on the table, it might not really land as well. So got to
Uh-huh.
pick and choose.
Ex I think that's now we're up to 3, penis references
Mm.
already.
Well, he did say he almost went into urology,
Yeah,
That's true.
it's still there.
It's just
that
still
can be
it's
forgiven.
still
Yeah.
there, you can't get rid of it. And so I want you actually you sent us a number of little stories here, and I know that you've written a book, right? I want to make sure that you talk a little bit about this book
Oh,
because
sure.
as what's a big part of this podcast is stories, and everybody in medicine has so many stories. So
Mhm.
could you tell us something from the world of anesthesiology that you think was interesting or funny or embarrassing? Give us something.
Sure. I think anesthesiology is a pretty mysterious field to many people. Surprisingly, even to surgeons, judging by the way they act sometimes. Uh, I
Yes.
I got to
Well, they
deal
don't
with
care about anybody but themselves.
exactly. I have to deal with patients who don't know anything or they focus on the wrong things. When I ask about, personal or family problems with anesthesia, or I'm looking for major life-threatening reactions, they tell me their second cousin twice removed got nauseated once after a colonoscopy, and I'd be like, I don't really care, but thank you. Or a common thing that they say is, I woke up during surgery once. I always have to act really shocked, really empathetic when I know 99.9% of the time they'll say it was like during a colonoscopy or a heart or a cataract
or
surgery.
cataract surgery.
Yep. And I
Yeah.
go, those aren't full
Yeah.
general anesthesia. Colonoscopies can be done awake. I had a guy come in for his colonoscopy who refused anesthesia because he had to drive his wife home after her colonoscopy that day. It sounded like a really roundabout way to incorporate butt stuff into their sex lives, but who am I to judge? Um, I don't know. Patients often say things like, after I list all the complications that can happen, they say, I don't care. Just make sure I'm asleep. And I always say, you mean make
Yeah.
sure you wake up, right? That's the hard part. People don't understand the risks. Um, a patient doesn't care that you manage his ejection fraction of 10%, severe pulmonary hypertension while they're exsanguinating on the table. All they'll remember is, feeling the tube in their mouth for 1 second at the end, or, oh, my lip is a little bloody. And that's a kind of a drawback of our field having advanced so much in patient safety that perfect outcomes are to be expected.
Yes.
I always say that anesthesiologists are like hockey goalies. We can't win the game, but we can definitely lose it for people.
Mm. Absolutely.
That's terrifying. I'm not sure I want to. I am very curious about what we should be worried about, but then at the same time, I don't think I want to know.
Yeah, I think that there's probably there's certainly a spectrum because I do a lot of informed consent as you do as well.
Yes.
And there are some people that really ask you, they go through it line by line and ask about all the different things. And there's some people that really don't want to hear
Mhm.
anything. Same thing with like during a conscious surgery. So cataract surgeries, people are
Mm.
awake. Some people want me to, they're asking me questions like, what are you doing now? What's the next step? And then some people I'll start talking to them about what I'm doing. They're like, please don't talk, doctor. I
Is that what your
please
wife
don't tell
says
me what
or
you're doing.
the patients?
Yes.
Yeah, exactly.
Just in general.
So
Just,
it's so interesting, the spectrum, that you'll see, whenever you're talking about these sensitive things and these difficult things that you're going to be doing to patients.
yeah.
Absolutely.
Well, because we're not awake for it, obviously, and
Yeah.
so we don't. I don't know. I guess ignorance is bliss. We don't know the things we should be afraid of, but what we are afraid of is we know we're going to be cut open, so we just really don't want to have to experience that.
Well,
I
sometimes
think
that's
that's where
not.
the "just make sure I'm asleep" comment comes from.
Yeah, and I totally understand that, but it comes to situations where I'm like, listen, going to sleep is really not safe, and you could die. And here's this alternative where we can do a nerve block, where we can make your arm basically a limp dead fish for a few hours, where you literally feel nothing, and I don't have to give you anything at all. And they still say, no, just put me to sleep. I have to
Yeah.
document, okay, you have
Yeah.
all these increased risks of death, heart attack, stroke, and they just
Mhm.
say, okay, I accept that. And as patient autonomy, we gotta do right by that. And as long as they understand everything, then we do it.
Well,
I've had a nerve block before. I'm a big fan.
Oh, what
yeah.
did you
I don't know
have?
why you
Oh,
would
yeah.
refuse.
The
Well, that was part of the my epidural cocktail.
Oh,
I
okay.
think.
I guess
Remember for kid one, it was an epidural and a block.
Oh,
I don't,
okay.
I don't remember much about why and what kind, but
oh,
I remember it was magical.
Very good.
I
you're
was going
you're
from
a
like
magician, Zach.
making mooing sounds, trying to get this child out, to immediately taking a nap. I mean, like that.
I do remember that.
Yeah,
Yes.
it was
I was
amazing.
remember asking,
20 hours in,
and then
and
I
I was
asked if I
just,
could have one.
yeah.
And but that wasn't allowed. So, but Zach, I have one more question before we take a quick break. Can you help me with my anesthesiology content? I could use. I've exhausted all of my anesthesia jokes. I feel like I've already done a joke about Malin potties and breaks. Like I've done all the things. I need some more. Can you help me out?
I can certainly be your reference, your
My
advisor
muse.
for anesthesia related content. You gotta let me sit down and think about
Good.
it. Because I mean, you already used the breaks in the Sudoku. That's 95% of the stereotype. So we gotta start digging.
That's
Hmm.
true.
We got
Move
the
on to
on-off
Candy Crush.
switch.
There's my tip.
Yeah, there you go.
That's right. I got to do that. All right, let's take a quick break and we'll be right back with Zach Antonov. Hey, Kristen, I have a PSA for you and all of our listeners from our friends from Tarsus.
Let's hear it.
You know how sometimes you can get red, itchy, irritated eyelids?
Okay.
Well, do you know what that might be?
What?
eyelid mites.
No.
Yeah, it's true.
No.
It's a disease. It's called Demodex blepharitis.
That's disgusting.
It's pretty common.
That's horrifying.
So if you have itchy, red, irritated eyelids, go talk to your eye doctor. They can take a look at you.
Tell you if you're not alone.
That's right. But don't freak out. Just get checked out. All right. To find out more, go to eyelidcheck.com. Again, that's eyelidcheck.com to get more information about Demodex blepharitis. Hey, everybody. There is a new podcast that has joined the Human Content Network.
I'm excited about this one
we got
because I'm a
family.
fan.
Yeah, we got a little family going here. It's called Explain Like I'm 30 with Sydney Raskin.
Sydney Raz,
Sydney
as
Raz.
he's known on the internet.
That's right. You may recognize him from TikTok as that guy that teaches a generation about life hacks for some reason nobody told you about. Yeah, everybody got all those little things that
Yeah.
could make your life easier that you don't know about. In this podcast, he'll be interviewing all sorts of cool people with awesome professions like a professional cuddler,
Mm,
a living statue,
mm,
and a hypnotherapist. Be
very
fascinating.
interesting.
So stick around until the end of this episode to hear the trailer. All right, we are back with Dr. Antonov. So Zach, we are going to play a game that's called Annoyed Anesthesiologist, which is a name I literally just came up with the second. Because what this is a game where I'm going to play the surgeon and I'm going to say a thing, a few words, a phrase, and you are going to give me on a scale from 1 to 10 how annoyed that thing I said made you feel.
With 10
Okay.
being the most annoyed.
10 being the most annoyed, like you're like seething with
Okay.
rage, but it's all underneath because anesthesiologists, you guys are so cool and calm. You're like straight, you never lose your cool. That's what like surgeons do. They lose their cool. Like they freak out at things. But I have never seen an anesthesiologist like really lose it because you can't because you're like things could like turn on a dime, right? And you got to like be able to handle things. So I feel like that's part of the personality with anesthesiologists.
I'm excited.
So anyway, what annoyed anesthesiologist? Okay, here we go. The first thing. Hey, anesthesia. That's it. That's it. That's it. That's it.
Uh,
Surgeon says, "Hey, anesthesia. How does that make you feel?"
uh, let's say during residency, that would have made me feel an 8, where I was more proud and cocksure and, all confident and indignant. But nowadays,
Uh-huh.
maybe a 2 or a 3. Um,
Oh, okay.
Mostly,
You don't mind when the surgeon doesn't know your name? It doesn't bother you too much?
so it really
You're
depends.
just so identified with your profession that now that is your name.
If it's a surgeon that's literally seen me day in, day out for years and they still call me anesthesia, then yeah, sure. Or if there's just so much turnover where it's impossible to learn everyone's names, I'll give them a pass.
Okay.
But otherwise,
Not too bad.
not too
Not too
bad.
bad. Okay. But still, surgeons, if you're a surgeon listening, learn the anesthesiologist's name. All right. If you don't know the name, make one up. Okay. At least then you can say, "Oh, I thought you were somebody else."
I
Sorry.
also know all the breaks make it
Um,
hard because we're coming in and now. You could take like 20 breaks in one case. Like, wait, are you John? Wait, now you're Frank? I don't even know.
20 breaks like, like every 5 minutes. Oh man. Okay. Here's another one. Anesthesia, bed up, please.
That I would say just a 1. I'm really not annoyed because
Okay.
they need
Doesn't bother
the
you.
surgeon needs the bed at a certain way to get the surgery done.
Yeah.
Honestly, if it makes you operate even 1% faster to get the bed at a certain place, please, by all means, tell me to go up, down,
You'll
left,
go with
right,
it.
side to side. I'll make it happen.
Perfect. Perfect. Okay. Good. So that's a 1. All right. Next one. 5 minutes later. Bed down, please.
Yeah.
Now, how annoyed are
Yeah,
you?
that would creep up to a 4 and 5 now. I'd be like your anesthesiologist that just makes a noise and say, "How's that?"
Yeah.
That's right. Yeah. Right. Surgeons can be a little finicky, a little picky, a little particular about things like that. Okay. Next thing. Let's have our med student close the incision.
Oh man. Um, I would say
I
on
don't know if at a community hospital where you're at now, do you have med students that come in?
we don't have med students. I think they sometimes have like PA students or kind of PAs that may not have as much surgical experience as
Yeah.
actual surgeons. So we still get that. But look, you're
All right, this is also the end of a, let's say, 4-hour case,
mhm.
open of colon resection.
Oh man,
Let's have our med student close the incision.
you're gonna see that we're just calm, cool, and collected, man. I would also say maybe a five at that because I'm not
Yeah,
too far
yeah,
away from
just
residency
mildly
and med
annoyed.
school.
Yeah,
Everyone needs their training. I
yeah,
totally understand that, and as long as I
yep.
actually know, then I can tailor it. If they say that, I'm like, okay, I got another half an hour left. I know exactly what to tailor, as opposed to all of a sudden, okay, we're done. You can wake the patient up.
That okay, what is that was my next one.
Ah, I
What
gotcha.
okay, what where are you where are you on the annoyance
Oh
scale
yeah, nine or
on a,
ten,
"Okay, we're done."
9 or a 10 right
Not yeah,
there.
that's like that's peak.
That's
Why?
Alright.
What is that? What?
well,
Tell us why that's so awful.
Well, sure. Like as Will has shown in his skits, we don't have an anesthesia on and off button where we just press a button and then magically they wake up and everything is all done. Sometimes we can do that depending on the anesthetic, but most times it's a process. Everything has to start dissipating and coming off, and it's kind of the whole landing process of an airplane. You don't just snap your fingers in the middle of the air and you're departing on the ground. Uh, that all takes skill, finesse, time. So if a surgeon says, "Okay, we're all done. You can wake him up. We got another case to go," I'll be like, "You just screwed yourself over," And then it makes me look
Yeah.
bad because everyone's standing around for 10 extra minutes waiting for the patient to wake up, glaring at me. I'm like, blame the surgeon. He could have given me a 10-minute warning.
Okay. Alright, next one. Anesthesia, the patient's moving.
oh, I'm okay. I'm gonna say a 2 or 3, but if you worded it as the patient is waking up, then an 8 or a 9. 'Cause
Oh,
there's a big
okay.
difference. All right. Patient's not waking up, just
That's a
involuntary
good point.
reflexes. Okay. If you say they're waking up, it makes me look like I'm just doing a bad job or keeping the patient awake. Um, but
Oh, okay, that's a good distinction.
yeah,
Alright, waking up versus moving. Okay.
exactly. And
And then what do you do then? What do you do if when the surgeon what do you do back there when the surgeon says, "Oh, patient's moving," and you're like, "Oh, it's a reflex thing."
I'd probably just give a little
Do you
more
give them
anesthetic
more
or more paralysis. Sometimes you have surgeons that
yeah.
are just like, patient's a little tight. Are they fully paralyzed? And you're like, they got zero twitches on the twitch monitor. What more do you want me to do? They're like, well, they feel tight here. And then you just say like, okay, I'm giving something. And same thing as the bed height going up.
Patient's a little tight. What
Right.
what does that mean? The patient's a little
Like their
tight.
muscles are tight when they're operating in them, and
Oh,
they
oh,
just
I
have a
see. Okay.
subjective feel that the patient is a little tight and not paralyzed enough to
Gotcha.
their liking.
And then you give the
I
placebo
give the placebo, and
injection.
70% of the time it works 100% of the time.
That's a s that's the surgeon placebo.
Yes.
Yeah.
Yeah.
I and also you mentioned another thing, a twitch monitor? Is
Yes.
that a
Yeah,
thing?
yeah, it's when we stream live on Twitch during the operating room and just, like, do comedy. No, no, it's, what we have, like, basically 2 electrodes that we can place on, like, either the face or the arm, and it sends a electrical stimulus 4 in a row, and you kinda see how many twitches they have on their arm, and if you have 4 out of 4 twitches, then you're not paralyzed, and if you have 0 out of 4, you're probably totally paralyzed, and somewhere in between is a scale of it, and that tells you kinda how much paralytic
Gotcha.
to give.
Gotcha. I didn't no idea you could monitor twitches. That's cool. I see this is another thing. Like this is the reason why like neurosurgeons and general surgeons they say that ophthalmologists are not surgeons because I have no idea what some of these things are.
Well, they have no
So
idea what
you know,
some
I'm
of the
just
things you do are,
I
so
that's true. That's true. They don't know what it's like to pull on an eye muscle
oh, yeah.
and have the heart
N-
rate plummet.
Okay. Moving
Anyway,
on.
okay, moving on. All right. All right. All right. I got we'll do one more. We'll do one more. All right. Anesthesia, what is taking so long to wake this patient up?
Wow. That would probably be a 10 for me. You hit a nerve there just because you really gotta have some balls on you to say that, you know, after doing an
You do.
8-hour case and then waiting until the last minute to say, okay, we're done. And then having the balls to say what's taking so long, because there's just so many things that can happen. Oh, I don't know, maybe the patient just had a stroke from the massive blood loss you gave them. There's just so many
That's
reasons.
true.
There are a lot nicer
Is it
ways to
is it
say.
Yes, that's absolutely true. You should never say that. That's never something you should say. Is it true, like, the longer the case is, like, the longer it takes to wake the patient up from? Is that, or do you have to start that process of waking them up a little sooner, right? So that it doesn't take too long? Is
Yes.
that your goal?
Yes, it depends too. There are some drugs and some anesthetics where you could be infusing them for 3 days and they'll still come off, within 3 minutes, but the vast majority, yes, the longer you go, the longer it takes to kind of wear off. So it's always nice to have a lot of warning ahead of time. And also just, occasionally looking
Yeah.
over the drapes and just seeing what they're doing, cuz if they're already starting to sew skin and they haven't said anything, you can probably start waking them up.
Mhm. There you go. Did I miss any? Did I miss any major annoyed anesthesiologist things that
Maybe
surgeons say?
oh, can we just do this case under a little sedation as we're trying to cancel a case? That's always a
Oh, that's true. We didn't even talk about canceling a case, which I recently learned is part of the residency curriculum, actually.
That's part of the
Is
oral
like
boards for anesthesiology.
is that oh, okay, that's what it is. That's something you actually, like, have to, like,
Like when to cancel a
what, no,
case, you have to know.
or even, like, how to communicate it with the
Yeah,
surgeon.
there's
Oh.
usually one scenario where they say, "Okay, here's the scenario of the case. You're canceling it. You have to talk to the surgeon about this." And that's always a very because they always get an actor who's just the biggest a-hole talking to you.
Right.
I that is so funny that, that's like a something that you're
Yeah,
tested on
there
to
should be
know if
op
you
is
can
there
be a
ophthalmology
competent.
oral boards or no?
Yeah, yeah,
Oh,
we do
okay.
oral boards, yeah, yeah, but we don't have, like, how would you respond to an anesthesiologist telling you that the
Yeah.
cataract surgery is canceled?
Have you ever I wonder what ChatGPT would say to answer that question. They pass the boards, right?
Yeah, so what is your strategy for broaching this subject with the surgeon who has no idea they're about to get their case canceled?
Uh, it's always best to frame it in a patient care and patient safety aspect, and always frame it as in like our patient. And I think the safest thing would be to do this, because if you just say, "Hey, potassium's 2, we got to cancel," that doesn't really come across well. And you always want to make it seem like, as you said before, it's the surgeon's idea to cancel, and that's truly anesthesia doesn't cancel cases. It's the surgeon
It's
that
true.
listens to us and says, okay, I guess I'm listening to anesthesiology and canceling the case. We
Yeah,
always suggest things because the surgeon can always say, I don't care, I'm calling this case an emergency, and we have to do it. And in that case, we say, okay, I'm going to write that down, and we're going to do it.
there you go. There you go. Annoyed anesthesiologist. Thanks for getting annoyed with
It's
me.
okay.
This
It
is
doesn't
great.
it doesn't take.
Uh,
I'm pretty cool.
let's let's take one more break, and we'll come back with a couple of fan stories before we wrap up. All right, we are back with Zach Antonov. So we're going. One thing we do, Zach, is we read a fan story. So people send stories to us about their time in healthcare, and I don't read these ahead of time, and so this we'll be experiencing this together,
Ooh.
and this will be very exciting. So our story today, we just have one story. It comes from David. David says, I tore my ACL about a year ago and had to have surgery. When I went in for the surgery, the nurse who put my IV in was struggled a little bit. I've always been praised by phlebotomists for how present my veins are, and after not drinking anything since midnight the night before, I knew it wasn't my fault. So that means, so when you're dehydrated, your veins are not as, like, notable and prominent, and so it can be,
Yeah,
right. It
they're
can be
not as
harder. Actually, we're talking to
engorged,
an
you could say.
anesthesiologist who puts
Yeah.
IVs in all the time. Yeah, tell us, is it difficult when patients are NPO and haven't had anything to eat or
Yeah,
drink?
it's certainly. I don't know if it's one of those things that's actually true or something we say to kind of put the blame on the patient instead of us not being good enough.
Make yourself
Yeah.
feel better. Gotcha. All right. So so David had flat veins, and it wasn't his fault. Um, my, My wife was in the room for this, so she recounted this for me a few times. The first time the nurse tried to stick me, they missed the vein. Not a big deal. I know that happens, but I think it riled them up a bit. They tried a second time, but didn't pinch me, pinch me how you were supposed to. and, and I gushed blood onto the
Ooh.
floor and the blankets until they taped the IV in place. That's the only time I ever heard a healthcare worker say, "Shit, I'm sorry." I'm sure the ortho bro loved including the puddle of blood on the floor in his
Yeah.
estimated blood loss numbers.
Oh, yeah, I always make that joke too when we make a bloody mess for IVs or A-lines. Um,
Yeah.
hey, man, it happens.
That's part of the
Sometimes messes happen, but as long as the IV gets in there one way or another, that's,
as long as it's
yeah.
in, right? That's what counts. You get more with the art lines, right? You can get more lot
Oh,
more
yeah, you get
bleeding there.
shooting geysers if you're not careful.
Geysers.
Geysers
Blood
of
Blood
geysers.
blood.
geysers.
That's delightful. All in a day's
Oh, yeah.
work.
The veins a little like an IV is more
Yes.
oozing.
Oh, okay.
Yeah, there you go. Do you put in all the A lines
It's
where you
it's
work?
a mix between, CRNAs and the attending anesthesiologist, so we kind of have a crack equally at it. But so yeah, I do
Here's
everything.
here's another one. Here's another one from a surgeon. Hey, let me try it.
I have never heard that. I think surgeons just want as little to do as possible with that. That's honestly almost as bad as what's taking so long for you to do everything. It's like, here, let me just do it.
I don't know if a surgeon has ever said that in the history of surgery.
How about the med student?
The having the med student try. I tried a couple of art line. They're actually harder than you'd
Yes,
think. I found them quite
they're
difficult
very
actually.
humbling.
Yeah, you would
What is
think
an
it's easy
art
because you can.
line? You're talking
An,
artery? You're
yeah,
putting an
so
IV in an artery?
yeah, putting like a I don't know what you call it,
Hmm.
catheter or what you put
Oh.
a catheter in an artery. A lot of times it's in the
Hmm.
wrist. It's like the radial artery,
Yes.
right? That's what you're using. And the thing is, like, you can feel it. You can feel the pulse, and it's like it's right there. It's right. Why is this so hard? And then, but then, like, you just miss it, and then you get bleeding, and then it like collapses, and you can't. I don't know. From what I remember, see, I've only done this like once or
Hmm.
twice, and it was traumatizing, and
Mm.
so I remember every part of
Yeah,
it. But
poor you.
I don't
I
know.
wonder how the patient with a giant hematoma and Swiss cheese artery felt.
That's what I'm thinking. I've had one of those giant hematomas
I
from
did feel really
Yeah.
a
bad.
bloodstain before.
It's I but I don't know. I guess
For some reason, they're
I
just hard. I don't know why.
they are.
Hmm.
Yeah, they're hard. Arts are hard. Okay, so thank you, David, for that story. You can send us your stories, knock knock hi at human-content.com. Zach, thanks for joining us. Just a pleasure to talk with you. Let's tell us about this. I want to make sure we talk about your book here. So tell us about it. What's about?
Sure.
Who's it for? All the
Sure.
things.
Well, I did write a book called I Watch You Sleep, A Doctor's Tales of Anesthesia and Chain Restaurants. Um, it's kind of it's not your when breath becomes air. You're not going to be shedding copious
Yeah.
tears here. Maybe a couple, but it's kind of an
Yeah.
unfiltered, humorous, meaningful memoir of sorts about a
Yeah.
life in medicine and anesthesia. So, kind of giving a cross section of my life through that lens, and kind of think maybe David Sedaris if he were an even more vulgar person and a physician, if I may afford myself. Uh, that compliment. So,
Yeah.
I touch on a lot of things that we kind of talked about
That's
here,
great.
and I kind of mix it in with kind of wild stories that may or may not be true. So basically, take everything with a grain of salt. When you read it, it's kind of half entertainment, half educational.
Yeah.
It's aimed, I think, towards a lay public. I don't get too technical in there. It's for people that are interested in
Hmm.
getting kind of a glimpse of that world. Similar to the worlds of like I don't know, House of God or This Is Going to Hurt, kind of that
Hmm.
kind of irreverent style.
Hmm.
It's kind of less common
I love that
because,
style.
as we said, doctors have a certain reputation and image to uphold. But we are
Hmm.
people, at the end of the day.
Yes.
um, so that's out there on
That's
Jeff
great.
Bezos's favorite marketplace. You can find it. And
Check
yeah,
it
for the
out. That's Amazon. In case you didn't know who Jeff Bezos was.
yes, and you can't see it for anyone listening, but there's just giant pallets of my books behind the Flannerys there. They must be real big fans.
Oh,
Ah, yes.
Uh,
We bought them in
yeah.
bulk.
absolutely.
Uh, well, I had a quick question
Awesome.
for you. Like, how do you handle the inevitable kind of criticism and negativity when it comes to like criticisms
Mhm.
towards the art and the humor aspect of things that you do?
Oh, yeah. If it's like 1 or 2 comments, like 1 or 2
That's all it
people,
takes.
well, if that's it, I kind of
Well, that's
ignore it
good.
for the most part. If it's like I'm getting a lot of the same types of criticism, then there probably is something there to
Hmm.
that. And I need to at least take it seriously, think about
Hmm.
it. Like, where's that coming from? Did I word something the wrong way? Do I need you know, to take the content down, whatever it is? Which very rarely happens. But you're always going to
Hmm.
get like 1 or 2, like,
Yeah.
kinda strange, negativity or people that are just really upset about what you said.
But that's always about them, not about you. When it's those one-offs,
Yeah,
like,
exactly.
that's an unhappy person having a bad day, or they've had something very specific
Hmm.
happen to them that
Hmm.
touched in some way, and, I don't know. I think it's easy to write off the one-offs, right?
The
Because you can't
valid
be all
yeah,
things to all
Yep.
people, so that's just not someone
Yeah.
that's your
And I think
people.
people that.
the valid criticism will be apparent
Mhm.
because it's gonna come from, especially if you have a large platform, it's gonna come from lots of different
Mhm.
places.
And I think
Yeah.
people that aren't in the creative sphere don't appreciate the vulnerability that comes with releasing a creative endeavor into the wild.
Mhm.
Because I'm sure when you were doing it, when I was doing it, I don't need the piddling royalties that Jeff Bezos ekes out to me from this book. I do it as a creative endeavor. I had something I wanted to say. I put it out there. I'm sure you were the same, and it is
Mhm.
very vulnerable. You put it out, you get people that like it, you get people that don't, you get people saying one thing or another, and I think it's just the nature of art. You're not doing something to please
Yeah.
everyone. You're not making a car that you want every single person to buy. You're making a piece of art that you hope just resonates with the audience you want and with enough people to make an impact, even if it's positive or negative. I'd almost rather
Mm.
have an average 5 out of 10 score and have it all be filled with tens and ones rather than just all being filled with fives. Because you at least know you
Right,
sparked a discussion, um,
Yeah,
you made
there's a
meaning.
lot of truth to that. That's
right.
actually a really good point. Yeah.
Yeah, if you're not ruffling a few feathers as a comedian, then you're
Mhm.
boring,
But if you're ruffling
so
feathers as a doctor, then you're fired.
Well, you could be. Yeah, I
Maybe,
mean, that's,
depending on the situation, yeah.
absolutely. But, also because a lot of what I do is
Hmm.
satire, and so you gotta evoke a reaction, and there's got to be some truth to it, and you got to like have a kind of an underlying message, and some people are going to agree with that message, and some people are
Hmm.
not. But I think the message is still important,
Yeah.
and you got to kind of take a side. That's kind of the nature of comedy and satire and
Is your
everything.
one
So.
low negative comment Jimothy from United Healthcare or something commenting on your videos?
No,
It's
it's me.
yeah.
Oh, man. Yeah. I actually, it's so funny that because the United Healthcare stuff, you'd think I'd get the only people that would disagree with what I say about United Healthcare is United
Well, they're
Healthcare.
busy sailing their
Uh,
mega yachts. They don't really care, I don't think.
they don't care. I mean, I do know that they see my stuff because I've talked to people that are in United
Oh.
Healthcare that have said that they see it, and a lot of them secretly laugh at it and agree with it and all this stuff. But maybe I'm just trying to sow discord within the United Healthcare organization by saying this. I don't know. But I'm okay. There's some people you're just okay with pissing
Yeah.
off, and
Yeah, I think if
that's
you
one of them.
believe in what you're saying,
Yeah,
and there's some substance to it and a reason for sharing it, then, naysayers,
yeah.
whatever. It's easier to write them off when you believe in what you're
Mhm.
saying, I think.
But Zach, keep doing what you're
Thank
doing.
you.
I love seeing people have creativity in medicine. We need more creativity, more people showing their creative sides, and so I think
It's
that's
been an
awesome.
honor
Uh,
talking to you for free when other plebeians have to pay $250 on Cameo to do it, so Could you just wish me happy birthday real quick so I can save
Hey,
it for next year?
Yeah, happy birthday.
Yeah.
Happy
Oh, thank
graduation
you,
right.
to
thank you,
your
thank you.
niece and nephew. Yeah.
Yeah. Happy birthday, Zach. Merry Christmas and Happy New Year. And
Congratulations.
congratulations on the thing that you did.
Thank you.
Well
I
done.
love it.
Again, your book is called I Watch You Sleep, A Doctor's Tales of Anesthesia in Chain Restaurants. Get it on Amazon. And are you on social media?
No, as I kind of alluded
What a
to,
weirdo.
I wanted to put something out there. My goal is not to just become a media
Yeah.
personality. So I'm not on social
Yeah.
media. I am just on the cover of books. That's all.
There you go. I actually, I'm very impressed, in fact. So it's
Yeah.
probably makes your life a little bit easier than having to promote yourself on social media. So
Where else do you write? Do you have anything you're working on?
Not currently. I've always loved writing fiction as well, but that's kind of on the back burner. I got some a kid on the way, a third kid on the way,
Oh,
so I'm busy with all of that.
yeah.
Maybe later.
maybe during those big colon
Yeah.
resections, you can,
Yeah.
When do you think I
finish a
wrote most of
chapter or
this book?
two. That's right. All right, Zach, it was good talking to you. Thanks for joining
You.
us. All right, thank you to Zach for joining us. And I just had I loved being able to ask all of my anesthesiology related questions. I think they got a great job. It's they're what they do is so difficult though. It's really
Yeah.
that like can you
A lot of
imagine?
pressure.
It's a lot of pressure.
Yeah.
Even like the routine of intubations. I mean, they have to get that tube in
Yeah.
because the patient's like not breathing.
I guess I never
It's
realized
gotta get in there.
before. Like, are you
It's stressful.
you're always intubated if you're under general anesthesia?
Yeah,
Are
because
you
you're paralyzed.
right? So
Yeah,
even
so you
your
can't.
lungs
Yeah, you can't breathe on your
breathe.
own.
So does that mean you're on a ventilator? Is it the same
Mhm.
thing?
Yeah. I mean, yeah, basically it is. Yeah, you got a machine that's
Wow.
breathing for you. Yeah. So
That's scary.
yeah. Anyway, and thank you for sending in your stories. Let us know what you thought of the episode. If you have any other suggestions for doctors, I think Zach might have been a suggestion to us from. We get a lot of
Yeah, I
people
love the
have a lot of
suggestions.
great
Yeah.
ideas for guests, and so we love hearing that. So send us your guest suggestions. We definitely have a few guests coming up and some future episodes that were
yes,
recommended
highly
to us.
requested.
And let us know what you thought of the game. Did you like the game? Annoyed anesthesiologist.
Seems like a little bit of an oxymoron now that we've gotten through it. Turns
right.
out not much can
Not much.
ruffle those
It's hard
feathers.
to ruffle their feathers. That's true.
Mhm. I guess that's good if you're in
Le-
such a high
Exactly.
pressure occupation. You want somebody that can keep their cool.
Even keeled, level headed type of person. Lots of ways to reach us. You can email us, knockknockhi@human-content.com. Visit us on our social media, all the social medias. We're there. Kick it with us and our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the listeners leaving feedback and reviews. That really helps. Go out there. Like, if you like the show, if you don't like the show, just never
Just
listen to us
bye.
again. See ya. It's fine. No hard feelings. But if you really like it, please leave a review. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like today, at Matthew Doye on YouTube said, came for the lulls, the LOLs, stayed for the eyeballs.
I see what you did there.
That could apply to a lot of things that I say and do in my life. So thank you for that.
You've converted an eyeball fan.
I did. Yeah, I love
Maybe
making
that's a
eyeball
future
fans.
ophthalmologist.
One can only hope. And all full episodes of this podcast are on YouTube, on my YouTube channel at Glaucomfleckens. You can also join our Patreon. Lots of cool perks, bonus episodes, or react to medical shows and movies. Hang out with the Knock Knock High community. We're there. We're active in it. Early ad-free episode access, Q&A live stream events, a lot more. We got a hangout coming up pretty soon. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, new member shout out to Baseball Rob, Sarah M, Ann P, and Kristen N.
Oh, we got another Kristen.
Another
It's even
Kristen.
spelled the same way.
It is, yeah.
Correct way.
The correct way. You're gonna hear from
I
some
know.
wrong.
We Christians have some strong opinions about that.
Shout out, thank you for joining us, everybody. Shout out to all the Jonathans, as always. A virtual head nod to you all. Patrick, Lucia C, Sharon S, Omar, Edward K, Stephen G, Roskbox, Jonathan F, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, Dr. J, Chaver W, Jonathan A, Leah D, KL, Rachel L, and Ann P. Thank you to all the Jonathans. Patreon Roulette, random shout out to an emergency medicine tier patron. Shout out to Rebecca O for being a patron.
Yeah, it's moving
Thank
into
you,
more of a
Rebecca.
cat purr.
What is it?
Everyone has left now.
That's a cat purr, right? Am I doing a good cat purr? I don't know. Anyway,
Yay.
this is this.
It's off the rails.
We're turning this into
It's like
ASMR,
an ASMR
channel.
Yeah.
Let me purr into the microphone for you all and call it a drum roll. Anyway, thank you for listening. We're your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Special thanks to our guest today, Dr. Zach Antonov. Our executive producers, Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brook. Our editor and engineer, Jason Portizo. Our music is by Omer Benz V. To learn about our Knock Knock High's program disclaimer and ethics policy, submission verification, and licensing terms and HIPAA release terms, you can go to glaucomfleckens.com or reach out to us, knockknockhigh@human-content.com with any questions, concerns, or jokes if you have them. Puns also work. Knock Knock High is a human content production.
Knock, knock. Goodbye.
As adults, I think it's obvious that we all stop sometimes and think, as much as I love my job, what other options are out there? What would it be like as a professional cuddler, a real-life zombie, a horse breeder, or a scuba diving pizza delivery person? My name is Sydney Raskine, or as I'm known around the internet, Sydney Raz. You may know me as the guy who discovers all the things we wish we knew by our 30s. But the one thing I've always wanted to know is, how do you get the world's most obscure jobs? And how do you even do them? Join along as each week I sit down to understand what makes these people tick and question to myself if I should have taken a different career path all along. Let's find out, internet, on Explain Like I'm 30. Catch new episodes each Thursday wherever you get your podcasts and on my YouTube channel at Sydney Raz. Subscribe now and let's learn how to milk a goat.
How would I clean when a porn set gets dirty? What should I use to build stilts that are sturdy? Where could I breed a new species of birdie? Explain like I'm 30.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.